I'm Varda, and the topic of my today's presentation is comparison of iron, zinc, and ferritin among small for gestational age and appropriate for gestational age mothers. Introduction. Small for gestational age is a term that's used for newborn having weight less than 10 percentile for its gestational age, the mother's fundal height that's less than 2.5 centimeter during pregnancy, and the baby's weight that's less than 2,500 grams at birth. The Sga infants are one of the vulnerable groups that have the multifold increased risk of the growth failure and adulthood disorders. The prevalence of Sga. Worldwide, the recent estimate for the Sga is higher than 30 million. South Asia has the highest incidence of Sga, that's 34%, where more than half of the 26% of the babies are at high risk of mortality. The prevalence of Sga in Pakistan is 11.98%. The main causes of Sga include maternal, uterine or placental, and fetal. The maternal causes can be like hypertension, kidney disorders, nutritional deficiencies, diabetes, cigarette smoking. The uterine or placental disorders are the placental abruption, placenta previa. The fetal disorders include multiple gestation, birth defects, and chromosomal abnormalities. Then pathophysiology of Sga. The nutritional deficiencies lead to the compromises in the nutrient supply. As a result, for the survival, the fetus responds differently. The fetus tries to provide more blood to the vital organs, and as a result, its size reduces by preserving some functions. This leads to the decrease in the lean mass and body fat of the fetus. When we come to the association of the iron and Sga, iron has got a significant role in cellular functioning of all organ systems, especially for the growth and development of brain in early stages of life, and is required during the pregnancy for fetal placental growth and development. Iron deficiency affects the fetal growth through impaired delivery of the oxygen to placenta, uterus, and developing fetus. Zinc. It's an essential micronutrient for growth of the cell, its development, and differentiation in fetus. Its requirements are high in infancy, and its deficiency can cause growth failure. In pregnancy, the zinc supplementation can improve the fetus length and weight. Rationale. Despite the high prevalence of Sga, only a limited number of the studies exist due to the lack of the gestational age data. Many studies previously reported that the frequency and risk factors of the Sga cases in different parts of the Pakistan, but there hasn't been any data regarding nutritional status of Sga mothers in Pakistan. Objectives: to compare and assess the nutritional status of Sga and Ag mothers by estimating their iron, ferritin, and zinc levels. Methodology and analysis. The study design was the case control, whereas the cases were Sgas and the Agas were taken under control. Sampling technique. It was the purposive sampling. The study settings, there were the BHUs. 5 BHUs were visited. Sga and Ag screening was done. Coming to Sga, 220 patients were screened, 151 were included on the basis of the inclusion criteria, 98 refused to participate, 53 were asked for the consent, 7 left the study without giving any reason, 46 were recruited, 6 dropped out, so the data analysis was performed on 40 patients. Coming to Aga, 183 patients were screened, 128 were included on the basis of the inclusion criteria, 56 refused to participate, and 72 were asked for the consent. 29 left the study without giving any reason. 43 were recruited, 3 dropped out, so the data analysis were performed on 40 Aga patients. So, first of all, the ethical approval was asked, then the diagnosis of Sga and Aga mothers was done, consent form and information sheet was provided. So the social demographic questionnaires were asked, 24 hours dietary call was asked, and anthropometric measurements were performed. The blood was taken. The inclusion criteria included the mothers of the full term healthy mothers, and they were in the ages of the 15 to 35 years. The exclusion criteria was deceased mothers and twin babies. 3 ml of the blood was collected, and then we looked for the level of the iron, zinc, and ferritins. The iron was monitored by Microlab 300. For zinc, we used automatic chemistry analyzer, and for ferritin, we used ELISA kit. The statistical analysis was performed by SPSS version 20. Then results. We compared the anthropometric data of the SGA and AGA mothers. Here are the parameters and the data. Then we compared the reproductive history of the SGA and AGA mothers. We found the significance in previous SGA history and socioeconomic status. We found that the prevalence of the SGA was relatively higher in those patients that were from the low-income backgrounds. So then we compared the biochemical parameters of SGA and AGA mothers. We found the significance in serum zinc level. For SGA, that was 60.85 plus minus 6.25. The p-value was 6.25. The p-value was 0.05. Conclusion. It's concluded that most of the mothers in both groups were from low-income families and their dietary intake was less than recommended. No significant difference was observed in the biochemical parameters of SGA and AGA mothers. Then recommendation. The study should be carried out on large sample size in all healthcare systems, including the hospitals. There should be proper nutritional counseling of antenatal mothers. They should be provided with supplements if deficient from early pregnancy. Besides this, we suggest short-term interventions like providing supplements or supplemented food for the meaningful findings. Here are the references. Thanks.